So, hi everyone, my name is Millie Plotkin. I am co-chair of the Social Media Committee for the Academy for Eating Disorders, and I am also a member of the Advocacy and Communications Committee. Today I have with me two researchers from the eating disorders field. And let me find your bios. So I have with me Dr. Philippa Dietrichs. She is a professor of psychology at the Center for Appearance Research at the University of the West of England in Bristol, in the United Kingdom. And I also have Dr. Dasha Nichols. She is on the Faculty of Medicine at the Department of Brain Sciences at the Imperial College in London in the United Kingdom, and she's past president of the Academy for Eating Disorders. So I'm very happy to be talking to both of you today.
Hi, Millie.
Hello. We are going to be discussing a new document that was published on the Academy website just last week called The 9 Truths About Weight and Eating Disorders. This is a companion to a previous document that was just the 9 Truths About Eating Disorders. So I'm really interested in how this came about, that the Academy decided to create a second document.
So we were asked by the Academy to write this document following a presentation that we put together for the Eating Disorders Research Society meeting in Sydney in 2017, during which we were debating or wanting to bring a debate to the field about the relationship between obesity policy, in other words, kind of public health approaches to obesity, and the way that they interface with the eating disorder field. And that rose, in the context of that discussion, and Philippa and others were involved in the presentations on that for that symposium, we raised a number of issues about eating disorder risk, but also about the role of broader cultural factors, including weight stigma, in relation to how various countries, and we were representing 3 countries in the symposium, were approaching what is understood as the global problem of obesity. So following that symposium, Kyle de Young, who was president at the time, wrote to us saying that the issues that we had raised were intersecting with issues that were being raised through the Academy on the various discussion fora and so on, and that it might be helpful to put out something that looked a bit like a position statement for the Academy around these topics.
And I think just to add to that, at the International Conference on Eating Disorders over the past few years, I think there's been increasing debate and discussion in the field in relation to weight bias, any intersections between the obesity field and the eating disorders field. And so what we were also hoping to do is to unite our field around these truths and to create a document that could be shared with other communities to really facilitate a constructive discussion around the topics that are discussed in the 9 Truths as well. And we saw this very much as a starting point to doing that.
Great. It's been fascinating to see on social media. This has gotten a lot of positive feedback, which I'm very happy about.
Great.
I think we're very pleased too.
So why do you think, you've gotten into this a little bit, but why do you think this is an important discussion in the field right now in 2020?
Shall I start, Dasha? We probably have slightly different perspectives as well. And to point out that Dasha and I come from very different backgrounds as well. So my work is in the field of body image prevention and weight bias, and looking at broader social and cultural factors which influence those things. Whereas Dasha comes from a psychiatry and more medical background, and certainly in her work interfaces between the eating disorder and obesity community. I hope that's an accurate description.
Yeah,
Dasha.
and I specifically work with children and young people, which is a factor too.
Yeah. And so even as we were kind of creating this document, we had differences of opinions, and it was, you know, over a year-long process really to create it. And it brought up lots of interesting discussions between the two of us, which I think are kind of reflective of some of the discussions that are going on, perhaps on social media or among certain communities within the Academy for Eating Disorders as well. So it was really important for us to be able to talk through that in a way that is respectful and constructive as well.
So to add to that, I guess for me, the key things that were that had led to the symposium that I mentioned, but also that fed subsequently into the document that were coming up were, as Philippa said, were arising within my clinical practice, and also within the research environment that I was working in and the policy environment that I was working in. So what I was seeing in clinical practice were children and young people who were receiving what I consider to be very mixed messages about weight and nutrition as they're growing up at a very vulnerable age. Sort of 8, 9, 10-year-olds kind of being told black and white facts about nutrition, having their anxieties raised about how to approach issues of weight and nutrition, and me feeling that they were really getting some messages that may be actively unhelpful in their attempts to learn how to self-regulate from an eating perspective and maintain body confidence, which I think we would all agree is essential for young people. So that was one factor. The other was that I was increasingly reading in the eating disorders literature that there was and again at various conference settings to do with eating disorders, that obesity work was beginning to be presented in those settings and appear in print. But obesity was often talked about as if it was the polar opposite of anorexia nervosa in that literature. And I was thinking, well, where's that come from? Because we would never talk about low weight and anorexia being synonymous. And yet somehow there were all sorts of inferences being made about high weight, as if it automatically, as if we could automatically assume what the thoughts and feelings were that went along with that. So that for me was a key thing. And I was, as Philippa says, I've done some work in the obesity field as well. I'm used to that in the obesity field, but to see it starting to come across into the eating disorders field, I was finding that quite puzzling, that people were starting to make assumptions about various aspects of about weight in relation to its implications for everything from its social valence, the behaviors and thoughts that went along with it, down to, you know, fundamentals of brain development and neuropsychology. As is a tendency in the literature, that if something's is on average in one way, people tend to assume that it applies to everybody. And I could see this language increasingly creeping into the literature, and I was getting increasingly frustrated by it, because the imprecision of that, it just runs absolutely counter to my science. You know, another example people might find a bit more familiar is if we said ARFID is this. ARFID, or avoidant restrictive food intake disorder, is an umbrella term. It incorporates a number of presentations, and the same is true for overweight and people of high BMI. It's not a one size fits all, and it was being talked about increasingly as if it was a thing. So my increasing frustration about that is that people were trying to generalize things and then being surprised when it didn't work, when things don't work. I mean, if you try and do a one size fits all approach to cancer, you will not get very good outcomes, because you have to be much more specific and precise about exactly what the needs of that individual are, depending on the nature of the disorder and the way that it's affecting that individual. So apologies for using that analogy, but I think when if you come at it from an illness perspective, it doesn't make any sense to me for people to talk about obesity as if it's a thing.
And I think, just to add to that, from my point of view, I do a lot of advocacy work working with policymakers, businesses and community organizations around trying to promote positive body image or body acceptance and body respect. And some of those programs are eating disorder prevention programs that we use. And one of the most common things that I get asked often at the end of the discussion is, well, don't we have an obesity epidemic? And therefore, should we be, promoting these messages about body respect and body acceptance, which really indicates to me this lack of nuanced understanding about weight and how it relates to health, but also the way in which weight is discussed. And also, I think, increasingly within the Academy for Eating Disorders and the research field, we are seeing more and more research looking at weight bias, fear of fatness, and the way in which people make judgments about someone based upon their weight, whether at the high end of the spectrum or the lower end of the spectrum. And up until this point, we haven't had a statement from the AED that's really speaking to that and addressing that. And so that's what I also think is really exciting about these 9 truths, is a way to kind of start that conversation on a more broader basis, rather than just say one plenary at the, at ICED or in one paper, for example.
Yeah, I also do policy work here in America. I'm on the board of the Eating Disorders Coalition, and certainly topics about obesity prevention versus eating disorders prevention have come up. And I think that I'm hoping that this will be very helpful in educating people about that, which sort of leads naturally into the next question that I have for each of you. As you've both said, you come at this from different perspectives. So Dasha, I'll start with you. How do you think, from sort of the medical perspective, what are your goals for what this new 9 truths will achieve?
I think the kind of, if I were to simplify it, I think the point that Philip has raised about understanding the nuance and complexity is important. But if people only take away 2 things, that for me would be really helpful. I was just thinking about, primary care physicians having a conversation. There's 2 things they need to understand. One is that they can't make assumptions based on people's weight. And secondly, that when they talk about weight, they need to do that sensitively. That it's not, and not to make assumptions in relation to weight. So those are the 2 key issues. The analogy that I used at one point during the discussion is that we don't want people not to talk about weight and eating. It is important for health. I think that's really important to address, particularly significant changes in weight. So I think it's really important that we don't expect people to avoid talking about the weight, that it's so sensitive that we can't do that. But a bit like talking about somebody's sexual health, we don't do it in an insensitive way. We do it in a way that is respectful and personal, and that it and or at least acknowledge that it's complicated and as we've said, politically and socially valenced for every individual. So that, for me, is that people might need to be specifically trained to know how to talk to people about these sensitive topics and to think of it in that kind of way. Because I don't know about you, but I certainly know that when I go to the doctor, we're not far off being sort of weighed publicly and our weight shouted out. And I know that young people who've come to the eating disorders clinic have actually described that experience in school, where they're weighed in front of their peers and publicly humiliated in some way. So it is actually, that important message, if that can be got across to healthcare practitioners, and healthcare practitioners are particularly vulnerable to weight bias, that for me would be a hugely important goal.
That makes a lot of sense to me. Philip, what about you from the, I guess, appearance and body image side of things? Do you have sort of top 2 or 3 goals?
I think what I'm most proud of, I guess, in the statements and what I'm hoping to achieve is that the conversations about weight don't just center around health, although that is one aspect of the conversation, but by explicitly recognizing the prejudice and discrimination and stereotypes that exist in our society around weight and appearance is really important, and also highlighting how this is a politicized issue and how it relates to social inequalities. And that is therefore, as Dasha said, Dasha's kind of touched on this, how, a health professional might interact with an individual. And sometimes there can be a lot of microaggressions that take place, not necessarily intentionally, through those conversations at weight, but also at a much more systemic level. There's a lot of evidence showing the impacts of weight bias in employment settings, in education, as well as healthcare settings, as well as on the school playground. And I think by highlighting that through this document is showing the much broader impact of that, and highlighting both at the individual level, but also at a broader societal and macro level as well.
So I think, again, this sort of leads into the question of, do you think that any of the topics in this document are controversial? As I said, so far in social media, everything that I have seen is very positive. It might be that the people who have a more negative view are just not saying anything, or saying it to each other in their offices, but not on social media. So yeah, are there any of these that you think are controversial and are going to lead to either positive or negative discussions?
So I think the two that are most controversial are the last two. I'll let Philippa speak to the one about positive body image, regardless of size. But for me, the one that I think is likely to have raised the most anxiety within the obesity world is the idea that dietary restriction may have negative consequences, given that dietary restriction is the primary tool of weight loss that is advocated. There was quite a lot of controversy last year, as you know, about a trial in young people that was advocating and using a restrictive methodology. This is, I think, an area of where the evidence in the two fields intersects. Because we have a lot of evidence in the eating disorders field about dieting behavior as a risk factor for the onset of eating disorders. I know there's been a recent very comprehensive systematic review of prescribed dietary restriction within the context of obesity treatment programs, and there didn't seem to be an adverse effect on eating disorder outcomes. But of course, most dietary restriction doesn't occur in the context of well-managed clinical interventions. And so that's an area where there's a need for some dialogue, really. Is like, when is dietary restriction harmful, when is it not? That's an area where there is, I think, potential for some a need for some discussion between the two fields about what does safe dietary restriction look like? What is the impact of fasting, intermittent fasting, for example, on eating behavior? Who are the individuals who are most at risk in those situations? That's where I think we need to get a lot more science, and B, a lot more dialogue.
And Philippa, what are your thoughts?
I'm thinking about it from a public health perspective and some of the kind of broad scale campaigns that we might see in relation, say, to obesity, and a lot of the messaging that is used around that. And I think, although it might not be controversial thinking of an individual health professional interacting with one person, there are a lot of kind of sweeping statements that get made in those campaigns, which link intrinsically, a person's behavior with their weight status and their health. And of course, those two things are related, but I think perhaps the strengths of the assertions that we've made in here about how the relationship between weight and health is very individual. And also that on Truth 7, that you can't make judgments about a person's behaviors, personality, and cognitions on the basis of their weight and appearance, because that is often the foundation of weight bias in the community, that those judgments get made just by looking at someone, and if they're in a higher body weight, for example. And the thing is, we see that among health professionals also. So I think that in there. Then, as Dasha said, point 9, which is about the role of positive body image and how it relates to health outcomes. As I said, whenever we talk about body image acceptance programs to certain groups, I sometimes encounter, I think, there is a fear that if, someone accepted and respected their body, it might mean that they would never engage in a health, behavior or anything like that, or they will never, move their body, or I don't know, there's a big fear around that. And I think the evidence that we have, particularly the work by Diane Newmark-Steiner and colleagues from Project EAT, we have some really robust prospective and longitudinal research which shows that positive body image is actually a protective factor when it comes to people's relationship with physical activity and movement, and as well as eating behaviors, as well as weight cycling. And actually, if the genuine intentions of kind of commentary and campaigning around weight and health are very much focused on those health outcomes, positive body image actually isn't a barrier to that. And accepting your body and respecting your body, listening to what it needs and giving it what it needs is not a barrier to any of those things. But that's not often the kind of natural thought process that happens. And certainly when I've talked to colleagues who might work in the obesity field or physical activity and nutrition, or I'm in health psychology, and the very traditional health psychologists have this kind of model of individual behavior and how it relates to health. And I think that that's quite challenging for them to think about what might happen if you didn't, if you weren't unhappy with your body, would you lose all motivation to engage in those behaviors? And, but then it taps into other research from the field of exercise, that we know that if people engage in exercise for extrinsic reasons, whether it's weight loss, to present their appearance in a certain way, they're much less likely to maintain the exercise regime, as opposed to if it's more intrinsic reasons like benefits to mood and psychological well-being. So I think although some of the truth might sound very obvious to those who might be more well-versed in terms of weight bias and in terms of positive body image, in my experience, when you move outside of our field, they aren't so. And so I think they could be potentially sources of controversy, but ones that we have evidence to support. And that's the next step in this process, is Dasha and I will be writing a paper to supplement the 9 truths, which brings to light the evidence behind each of the truths, because we took a very evidence-based perspective to creating this document.
I really look forward to seeing that. I've read the science behind the original 9 truths and found it very helpful to be able to show people that evidence. So it would be great to have a similar piece for this 9 truths.
Yeah, next on our to-do list.
Yes. So before we wrap up, is there anything else that you would like to add? Any points that you think that you wanted to discuss and missed? Or the answer might be no.
Not particularly. I'm interested to know whether people from the obesity field, if that's a valid descriptor, have seen and reacted to these as yet. I find when I present them, and I have done, I tested them out on a few audiences before as part of the process of developing them, and the feedback is universally positive within the eating disorders field. But as Philippa says, the question really is how well they will be received outside the eating disorders field, because I think at a policy level, we're unlikely to have significant impact unless they have what traction with a wide audience.
That makes a lot of sense. And I think at this point, it does remain to be seen what feedback we'll be getting, since this is so new, at least as far as the published document.
Yeah.
And I also think we hope that it stimulates discussion and constructive discussion, and actually moving our field forward, but also moving the way in which we interact with other fields and policymakers forward in a more constructive way that has positive outcomes in terms of health, but also in terms of addressing social inequality as well when it comes to weight and eating disorders.
And stopping potential negative messaging, which is impacting young people.
Yes, definitely. And even not just young people, because this carries out throughout the lifetime.
Of course, yeah. Sorry. Selfishly thinking about my own patient group, yeah.
Right, of course, you have your specialty. There's nothing wrong with that.
Of course.
So I think we are ready to wrap up for the day. I'm very grateful to both of you for your time. This has been a fascinating discussion. And as I said, I'm looking forward to the article that you write about it and seeing where we go from here in the field.
Well, thank you very much. Thank you for your interest.